This is the discussion post for week 1 of MHA 690, Health Care Capstone, on confidentiality. Reading the report. The Fox News report tells us that over 120 workers at this UCLA hospital looked at medical records and personal information belonging to celebrities. The issue occurred without permission, of course, and as time went on, it seemed the numbers rose according to a state report. The employees were disciplined or terminated when located. The organization eventually updated software that would block Social Security numbers partially and train staff on security, privacy, and confidentiality. It was all too little and too late. What training could you as a manager put into place to avoid this situation? The incident discussed occurred between 2004 and 2006. Since then, HIPAA and privacy have become household words. Most of us have knowledge of what it is, but there are still breaches, many of which are unintentional. Privacy keeps our dignity intact and avoids publicizing embarrassing issues. We often hear of lawyers having an attorney-client relationship, but we have patient-clinician relationships that must be protected as well. Keeping a good relationship with our patients can prove to be invaluable. HIPAA, the Health Insurance Portability and Accountability Act, is designed to protect the privacy and confidentiality of patient information. This applies to health information in all of its forms. Prevention would come in the form of control of access to decrease traffic and use of records that staff do not need access to, encryption of private data to prevent theft and intruder access, requiring authentication via the use of electronic signatures, flags to warn intruders they're being monitored, and even report that occur with every flagged alarm. Celebrity records should be monitored more closely by IT for intruders. How can this training on confidentiality be effective for employees? Being cognizant of the need to keep information confidential and private is only a start in the process. Security involves awareness, but it takes more than awareness alone to prevent a breach. That descriptive more comes in the form of training and then enforcement of that training and of the mandates set forth by HIPAA. It will also involve organizational policies and procedures that require our compliance. Paper records are not the only records that can be breached. Electronic and digital files and communication are all subject to privacy standards. It's the responsibility of the organization to make sure that the employees are aware of policies and procedures governing privacy and are made aware of mandates of the law that must be adhered to. The law does have mandates that must be followed according to HIPAA rules. Compliance should be linked to performance as well. Disciplinary actions should be discussed, including termination when hired and annually, for breaches of the policies and the procedures. The staff should know that a watchdog system is monitoring them, and it should be done through IT. A good way to drive this home is to enact contracts with each individual regarding compliance. It's the responsibility of the individual at that point to comply with the contractual agreement or risk discipline that could lead to termination. Thank you.